Welcome to this webinar on the issue of the health system resilience post-COVID and how we move towards more European collaboration. This is a central issue indeed after COVID. We learned an awful lot about how to strengthen the resilience of our health systems, and we're looking at how to build back better those systems. In that role, obviously, there is a key importance of working together with the European Union, having collaboration across Europe. We'll have these slides later, Lucy. So the topic of the seminar today, which is co-organized between the DGOS, la Direction Générale des Offres de Santé, and the Observatory, is exactly on that, on looking at best practice for resilience, and more importantly, what is the value added, what is the importance of the collaboration at broad European level. This is very much at the core of the French Presidency, at the core of the research, of the evidence we brought together with the DGOS and the Observatory, and is at the center, of course, of the webinar today. So in that program, we'll start first with a presentation from the International Department very short presentation about summarizing the objectives and the approach of the French Presidency, broadly speaking. Secondly, you'll hear from myself and Robert Touret the work we've done together with this special issue of EuroHealth, the evidence we put together to support a ministerial conference and to support the French Presidency. Then we'll have spotlights going in more detail in 4 specific areas, and leaving enough time. I promise you will have enough time to have a good debate with the participants today. The presentation today is bilingual. If you go down, you have a glove there that says interpretation, so you can choose either English or French. And as you know, this will be later available in YouTube with all the slides and everything else. So without much further ado, I'd like to first introduce, therefore, Malika Mestiri. She is from the International Department, and Malika is going to give us a bit of a sense of what the French Presidency is about. Welcome again. Malika.
To all the participants, as you said, resilience is a key priority, particularly since COVID-19, and it is one of the key topics of the French Presidency. We are looking at strength and recovery. These are 2 very important words for us because they encapsulate all the will that we have developed when it comes to health issues. Now, we all understand the word power and strength. There is, of course, this idea of health sovereignty. Then recovery, we need to make sure that our resilience is a success, particularly when it comes to the recovery and resilience plan and the national plans of each member states through this partnership, thanks to the European Commission. And finally, this sense of belonging. Prevention is also a very important word for the entire sector. So the idea of the French Presidency's proposals for the health industry was to finalize the ensemble of health systems works thanks to a very ambitious package that was presented by the European Commission in November. We want to strengthen regulations and the mandate of European health agencies, specifically the EMA, as well as regulations on social security systems, etc. We will be handing over to the Portuguese presidency soon. And then there was also the Slovenian presidency. So we want to finalize all of this. We're going to have our final council on the 14th of June. And the idea of our presidency was to continue this work that we deemed necessary And then there's this new agency, the HERA. Then we need to strengthen public health policies. They already exist. But then work was done by the Parliament. And this work was done in a hybrid manner despite the health crisis. And we wanted to boost and strengthen public health care systems so that we could go beyond the already existing health systems that we have within the European Union. So the idea of having a strengthened healthcare system was that we wanted it to lead by example when it comes to our other international partners, in partnership also with the work that we do with the WHO, for example. Under every negotiation, the French presidency wanted to bring up these issues with their international counterparts. For example, the ECDC, the HERA, and so that they could dialogue with their African or American counterparts, for example. Now, when it comes to resilience, we began our presidency on the 18th of January with a conference dedicated to the resilience of health systems. And we came up with a proposal to strengthen this collaboration by using the example of cross-border healthcare so that we could have better, stronger healthcare systems. My colleagues are going to speak about this later on. We continued with other conferences in February. They adopted 16 proposals, which they wanted for them to be adopted, and they were then adopted unanimously. And then on the 3rd of May, the European Commission published a proposal on the regulation of health care data. And for this, we are going to organize another council on the 14th of June so we can have an exchange between European health ministers. We are also going to talk about rare diseases and the fight against them. That will be included in the discussion. We wanted to have a European plan that will help its citizens. This is one of the priorities of our presidency. It wants to facilitate research. And on the 29th of March, we organized a discussion dedicated to the fight against rare diseases as an example or a model of how we can boost healthcare systems, particularly when it comes to the digital transition. We also insisted on the fight against antibiotics resistance. And another important issue for us is the external aspect of the French presidency, or rather of the European Health Union. It needs to be very strong on the international sphere and needs to be united in solidarity. This global health was the subject of a European ministerial conference on the 9th of May in Lyon. European health ministers and foreign ministers came together. And I believe that all member states were in agreement with how to review this strategy. At the same time, we wanted to continue the coordination because the health crisis was still ongoing.
Pardon, Malika.
Sorry to interrupt you, Malika, but we really don't have very much time. I'm really sorry, because we didn't give you very much time to explain everything that your French presidency wanted to do. But maybe you could use the time later on during the panel to continue. But if you could wrap up now, please. Yes, I'll just finish my sentence then. We had COVID-19 followed by Russia declaring war on Ukraine. And then there's now the current crisis of the monkeypox, which is also the subject of many discussions. Thank you very much, Malika. I'm very sorry, we don't have very much time, and it's really difficult to explain the entire French presidency in just 5 minutes. But please stay for the discussion that will be taking place later on. I'm sure there'll be a lot of questions about the French presidency.
Introductions of the work we have done together with the DGOS, the Director General of the Health Services, with this especially EuroHealth. If I can have my presentation, please. So the topic of my presentation is the same one as of the topic of the seminar today. So health systems resilience, how can we move towards more European collaboration? Again, I'm very grateful of the work together in this area. Next, please. It's important that the resilience is not just the resilience we learn of the health system from COVID, but how do we work on the forthcoming challenges? This slide shows you some of the work, some of the research. Erica is going to put that in the chat box that we've been doing in this field in collaboration with WHO, with the European Commission, and indeed, the special issue that we did in collaboration with the French Presidency and DGOS. So there's lots of resources to learn about best practice, best lessons around health systems resilience and how we learn from the future. Next, please. This is a shopping list that you don't want me to go through because we'll take the rest of the afternoon, which is the 20 strategies that we identified in our research as central to build resilience and build back better. They're around leading and governing the COVID response. They're issues around leadership, around communication, around vertical and horizontal coordination, issues around transparency, and in particular, of course, issues about international collaboration, collaborating across borders, which is very much the core of the seminar today, the role of the Europe and the European Union in this field. We looked as well at a number of strategies around financing. We looked at UHC, universal health coverage, as central to resilience. We looked at the joint procurement. We have really good practices in joint procurement between member states in the area of a number of innovations, technologies, and in particular the vaccine. Needless to say, we'll hear a bit more about that, by the way, on the health workforce, on the protecting the workforce, on recruiting, on training the workforce, on new skill mix. We learn a lot from the pandemic, and there are many lessons we want to take forward. Strengthening public health interventions, needless to say, and the delivery. We'll hear a bit more today about the delivery of health services. We've seen new pathways, we've seen lots of innovations, we've seen development of guidelines, we've seen new digital tools and mechanisms to support effective delivery, which again will be central in strengthening the resilience of our health systems. Next, please. If I had to summarize very briefly on this very quick overview, I would say leadership and governance are essential, and participatory governance, not rocket science. We do know that we need to involve the professions, we need to involve the civil society, we know we need to involve various actors in governance, but one thing that clearly the crisis has shown us, that to be resilient, we need to have this participatory governance. We'll hear a tiny bit about that later on. One important lesson is how do we harness and implement this innovation? We learn a lot, as I said, lots of innovation. We've seen some countries going backwards. How we harness that, how we implement it. Another important lesson is that it's not health systems resilience, but it's across sector resilience. So the resilience goes beyond the health sector, goes into the social sector, goes into the economy. We cannot forget all those elements. And finally, as I said already, which is the topic of today, is success will depend on European and global governance, which is the topic of my next slide. Next slide, please. So we're talking today about European collaboration. What are the kinds of instruments that are central during the pandemic and for the future recovery? Clearly, member states have realized that they need to work together for security and resilience, and there is some need to pull some sovereignty. In particular, member states have agreed on a stronger European Health Union, extending mandates to the ECDC, EMA, with a new HERA. But the question from me today, not the French presidency, not the DGOS, but from me today is, shouldn't we go beyond? Not only viruses cross borders. There are many of the shocks that cross borders, and we need to have resilient health systems. So some of the issues that we covered in that research, in that work for that presidency, for the ministerial conference, is how do we maximize cooperation and EU instruments. So instruments about supporting One Health, health coverage and access, cross-border collaboration, access to innovation, including joint procurement, support with reform implementation, digital health, and implementing joint workforce planning are some of the areas where perhaps we want to build more EU collaboration. Next, please. So this is the way that the cover of that special issue of EuroHealth I've been talking ad nauseam to you looks like. And these are some of the themes that are covered in there. Please, Erica, put a link into the chat to the EuroHealth so people can download it together with all the other materials. And these are some of the issues that I'll be introducing in a minute and in which we'll go in more depth. So that's it for me. Robert, je vais te donner la bienvenue et adresser à...
Robert, welcome. I will now give you the floor. And first of all, thank you very much. I would like to thank you and the whole team for this joint work and the cooperation in organizing this event. Thank you so much for all that you have done. And thank you so much for your resources and for working together with us. Thank you. The floor is yours. Hello, Josep. Thank you very much. Welcome. First of all, I would like to thank Josep and the whole team from the observatory. Thank you so much for the invitation as well. Obviously, today we are talking about the resilience of healthcare systems after COVID. We have been working together with the observatory on a significant scale. So, the COVID-19 pandemic struck and hit our healthcare systems. We had to adapt. And the adaptation really tested our resilience. The European Union had to organize a common response, and they did. Healthcare usually is one of the competencies of the member states, but nevertheless, we realized that something needed to be organized at the European level. The French presidency was a real opportunity for us. In fact, we organized several different events at many different levels during the French presidency. We organized a high-level conference on the resilience of healthcare systems on the European level. I think it was already mentioned earlier. We brought together many different health ministers from the European Union. We also brought together many different significant actors from the World Health Organization in particular, and we talked about all of these different topics. This conference allowed us to talk about and deal with COVID's impact on our healthcare systems, and the aim was also to reinforce and strengthen links between member states. The idea was to talk about different tools to reinforce and improve our cooperation in the area of health. we, of course, were able to organize this edition, thanks to the contributions of the Observatory. We worked together a lot with the Observatory. And this also allowed us to explore the theme of resilience and the theme of solidarity, as well as the theme of cooperation between member states. It allowed us to shed light on various different initiatives in order to deal with the crisis, initiatives that were put in place to deal with the crisis. And the overarching aim was to reinforce resilience. During that conference on resilience, there were many discussions between healthcare ministers and other actors. And many different instruments for cooperation came out of those exchanges. This was often on a voluntary basis, but the idea was to promote cooperation. So a label came out of this, a healthcare label. DG Santé was included as well, the Directorate General for Healthcare. The idea was also to facilitate access to cross-border care. That was another of the issues that was talked about. We also wanted to exchange good practices. We wanted the healthcare ministers to exchange good practices among themselves. The speaker's sound is very difficult for the interpreter to hear the speaker. The important thing is to put patients at the heart of the healthcare system. That is really central, and we needed to ensure high quality care for all European citizens. These were some of the issues that we have dealt with. These initiatives needed to be worked on with the whole of the European Union and member states. So these are the aspects that I wanted to share with you today. And I will now free up the floor for anyone, for the next speaker rather. But thank you very much for the work with the Observatory. Thank you very much, Robert. And also thank you so much for sharing the idea of the hospital label. I know that it's a process which is being debated about with the European member states. I don't think necessarily we should come on to that today because it's still in its infancy, but it's a very exciting proposal for the member states.
It's the time for our colleagues to vote. Could you put the poll, please, so everyone can vote? One, how many Eurosceptics we have today, please, and then what they like to see.
Yeah, thank you very much, Annalisa. So yes, first question, how much European Union collaboration do we need? Just a little question for you to see where we are. Do we need more? Do we need less? Or is it just fine as it is? But then also, if you could, you can answer sort of like maybe 2 or 3 times with the second question, which is which areas might benefit from greater collaboration under the European Health Union? So could we be supporting One Health more, the AMR agenda? Could we be enhancing cross-border collaboration through the European hospital networks? Could we be increasing access to innovation and technologies, including joint procurement? Could we be providing more support with reform implementation and exchange of best practices? And could we be using it to advance digital health, to implement joint workforce planning, or indeed none of the above? So thank you very much for that. Looking forward to getting your responses. Thank you. Josette, back to you.
Thank you very much. Keep the pool a bit longer, please. I'm very, very keen that you respond to that. Remember to scroll down because there are several answers. Please you can choose all of them, few of them. And I'm very keen to see how many of our participants today want to see more or less European Health Union today. We'll use those results later on for our debate. Thank you very much indeed. Let's now move to the spotlights. We're going to have now 4 spotlights looking at in more detail at 4 aspects of the points we talked about today I introduced in my presentation. We'll have first Pascal Melihan Chenin du ministère de la Santé et la Prévention et Gustave Eiffel Université à Paris, qui nous va expliquer un peu plus la participation réelle, parce que Pascal, on parle beaucoup de participation.
Pascal, we often talk about participation. Participation is really important, but what does it actually mean? What does real participation mean in the case of healthcare systems? You have the floor, thank you. Thank you, Josep. So we noticed during the healthcare crisis that getting people to take part was actually quite different. It was a different thing. It was a different issue entirely. So we had forums with civil society organizations. There were various bodies for that in France, democratic bodies. But there are other ways of doing that as well. In America, they talk about social participation. Elsewhere, people talk about participative governance or participatory governance, rather. And then there are processes relating to participative democracy. So public debates, we're talking here about citizens' conferences, citizens' workshops. And these are all ways of involving citizens outside of the election process. So the idea is to consult citizens and involve them, because these are often the ones who are most vulnerable. They suffer from inequality in this area, and sometimes they can't express themselves and express their views. So first of all, this is a question of good governance. A study was published in an international magazine in 2021, and it showed that governance had to be open, and it had to be transparent and responsible and accountable. For example, there was the example of resistance to being vaccinated. In France, for example, there were some regions which really didn't want to get vaccinated. And we had to work very hard, not just during the crisis itself, but we had to engage civil society. We had to engage citizens directly in this area. The idea was to be more reactive, more flexible in times of crisis. We need people to be more on board with these policies, and we need the policy to be more efficient as well. This is not just a question of democracy. There are issues related to efficiency and not just a democracy when it comes to public health policies. So these recommendations are linked to a study which was edited by the World Health Organization in 2021. And you actually have that on the left-hand side of the slide. You can access it very easily online. It's a handbook edited by the WHO. And there are other resources as well, because it's a very essential issue. For 20 years now, we've had what we call democracy in terms of health. There were other examples, such as Portugal, which organized a national health conference. Josep, I don't know whether you wanted to take the floor. No, that's perfect. That's perfect. Thank you. I recommend that everyone follows what's happening in France and Portugal. France is a real leader when it comes to participation. And all of this has been very well explained. Participation is also linked to issues surrounding vaccination. If we don't have participation, the situation will not be positive. Thank you so much for that presentation. Thank you so much. Now I will give the floor to Nathalie Schneider. Nathalie Schneider is going to be talking to us on behalf of the DGOS. She's going to be talking about services. COVID-19 gave us a lot of experience in innovation, and now we have to sustain that momentum. You have the floor for around 4 minutes. And could you explain a little bit about what's been going on with regards to innovation in France? Yes, of course. Thank you very much. Hello, everyone. Yes, indeed. The COVID-19 crisis did have an impact on how our practices evolved and how they changed. It had an impact on how we organized these policies, and it gave rise to a new dynamic, a new momentum. I'm talking mainly about collective organizations. COVID-19 really showed the strength of working together. We have healthcare centers, for example, which play a very important role. And then we also have the professional communities, professional healthcare communities. Basically, these are French organizations within the different territories.
Intégrer les maisons de santé, les centres de santé.
And include these health centers. So we included health establishments and social medical care services. These are the main coordination exercises that currently exist. And then with the COVID-19 crisis, it was actually thanks to this collective that we were able to improve these connections between hospitals and what we call CPTSs in France. They were able to be very flexible and reactive. They learned a lot from the crisis, thanks to their partnerships with other healthcare centers. All of this was greatly improved thanks to the COVID crisis. For example, the CPTSs worked with healthcare establishments to organize patient care and hospitalize these patients if needed. These CPTSs also were able to distinguish between and work with COVID patients and non-COVID patients.
Next slide, Lucy, please.
The second very interesting aspect for us when it comes to improving access to healthcare is using remote healthcare appointments and teleconsultations, for example. Before, the doctor had to see the patient in person within 12 months of having a video appointment with them. We did, of course, relax this regulation. And since then, it has become something far more long-lasting, something that is here to stay since the crisis. We are using video healthcare appointments far more. You can also have them with healthcare professionals or even pharmacists. This practice also, it started during the crisis and also seems to be here to stay. This change has been accelerated because of the COVID-19 crisis, and we want to keep up the momentum. I hope I respected my time limits. It was absolutely perfect. Thank you very much, Natalie. There are some things that I think the participants will want to know more about. So that is the CPTSs that you were talking about, so the community healthcare services. And now telemedicine, technology, training, and all these different things that you had to put in place in France to ensure that telemedicine be adopted and expanded. Thank you very much.
Matthias Wismar, to give us time, to save time, you have to deal with two topics in 6 minutes, which is the two topics around cross-border, key to the French presidency, as well the health workforce that we've already been talking about.
Thank you so much, and I tried to bring a couple of messages across in all brevity. I think it's true, you cannot speak about collaboration in Europe without talking about cross-border healthcare. And this is an area where adding value is so clear and straightforward. Patients can benefit from it because it covers Europeans who fall sick abroad, whether you're a student, a pensioner, a tourist on duty travel, a postal worker, or even if you have a precondition like dialysis, you will be taken care of. But over the years, we also had increased options to receive planned care abroad, which is really great if you have, Joseph, for example, a long waiting list, or the treatment is not available in your country but evidence-based. That's very important, maybe even more important for smaller countries. And quite importantly also, it can help patients with rare diseases who cannot access diagnosis and treatment at home. We have the European Reference Networks, which is a network of centers of excellence connected, where mostly the patient does not need to travel, but the evidence travels. And that's really, really, really great. And of course, and that's very important, and in particular, when I look to France with all the bilateral agreements between France and Germany, France and Belgium, France and the Netherlands, we have covered in the EuroHealth actually a cross-border hospital. You can see how important this is. And last but not least, we have seen also in COVID-19 that at high level, agreements were made to move patients during the pandemic from one country to another, and also to help doctors sending from one country to another. There are two main legal frameworks on which this is based. One is more for the competent authorities, and the other empowers the patient and citizens to go abroad and choose treatment and diagnosis. But I'm mentioning this because it's very important. It's an entitlement, it's a right. Next slide, please. So there has been an evaluation of the Cross-Border Patient Rights Directive very recently, and it came to the conclusion that the directive has been moderately effective and is delivering on its objectives to some extent. It has been clearly a driver for patient rights, so which is a secondary effect, actually, more transparency on treatment prices, and it had a substantial impact in the area of rare diseases. I already mentioned the European Reference Network, but there's, of course, a lot of room for improvement. There's very often low level of awareness, actually, of the rights to cross-border care, inadequate patient information. Probably many are withholding because they don't know about it. There are disproportionate administrative burdens, so it varies from country to country. There's sometimes uncertainty about cost reimbursement. And talking about the great success of the European Reference Networks, Joseph, we have to acknowledge that they are not yet quite sustainable. So the Commission came up actually with 11 follow-up actions under 4 headings to enhance the implementation of the directive. And I don't want to go into detail here, but I think they are pretty much acknowledged by everybody and also by the scientific community. The only question is, and Lucy, please, next one, do we have really the instruments which help them to implement? Because very often the Commission needs to encourage, needs to bring people together, needs to share evidence, but not always they have the right legal instruments. Lucy, next slide, please. Human resources also crossing the border. We have a European labor market, and from the COVID-19, we've been talking about what do we learn from COVID-19. Number one is we still have in some countries shortages, sometimes only in areas, sometimes only in specialities, but we need to scale up. And of course, when we talk about the labor market, we have a common European labor market. The 5 regulated professions, doctors, nurses, pharmacists, midwives, and veterinaries, they can move quite freely across borders, but we are lacking instruments to address the weaknesses of these labor markets. And the weakness is certainly that we have no clear monitoring. We don't know where the people coming from, where they're going, how much do they work, We have no European health workforce planning and forecasting to remedy some of the problems we currently see. And of course, there are still shortages around maldistributions. And even in those countries which have plenty of doctors and nurses, we have medical deserts. We've also learned from the COVID-19 pandemic that we need to upskill. The health workforce skills and skill mixes could better match common European health data space, for example, but also models of care in countries. So many countries are trying to implement integrated care, primary health care, all sorts of things, and we still see there is a digital skills gap. And I think this is not to fix for one country on its own, because we are moving cross borders. You know, we are moving patients and we are moving professionals. So it's something which we need to address together. And of course, we also need to implement in countries effective skill and skill mix strategies. And I think also the European Commission, which is very eager to help provide access, timely access to quality healthcare, will think about these issues. Finally, what we've seen in the pandemic is that we need to protect health workers if we want to retain them, if we want to keep them in the sector, if we want them to have a good work experience. And we need to protect them physically. In particular, in long-term care, we had problems with personal protective equipment. Many people suffered from exhaustion, and of course, there's always the problem of patient violence, which we have seen in the past. There are also social issues. If you don't have sick pay in your countries, you might be tempted to go with a cold. And if it's not a cold, you go to work, but it's COVID, then you have already a problem. And of course, salaries are not good in all countries and in all professions. Childcare is an issue. And finally, we need to help health professionals to address distress and burnout. Lucy, next slide, please. And this is, I think, one of the key messages coming from the COVID-19. The pandemic has demonstrated how valuable the health workforce is. They were extremely agile. They were extremely flexible. They were really so important in all these processes. But at the same time, we have seen how vulnerable health workers are. And I think a European health union could contribute to strengthening the health workforce, and with it, health systems resilience. So thank you so much.
Matthias Wirmark, head of program here at the Observatory on governance and human resources. We heard that to build this European Health Union, we need many other instruments around cross-border, around also the joint action in planning, in skill mix, and protecting our health workers. Now I'd like to introduce Dimi Pantelli, who's the head of program here in innovation in the Observatory, who's going to tell us about how do we get there? What kinds of tools are there available? In 4 minutes, Dimi.
I think negative 4 minutes, Josette, based on the clock. I will try to be brief. I don't think I will take the 4 minutes. The question, I think, from my spotlight is, what support tools do we have at EU level that can help us ensure that health systems become more resilient in the future? So I will try to split the time that I have in two. So first, I would like to show you work that we did ahead of the French presidency with the Slovenian presidency of the Council of the European Union, where we realized that there are a lot of things that the EU supports member states with when it comes to health and health systems, but not everyone necessarily understands what these tools are or how they can be used. So we took a look at what the available tools are. You can see our policy brief here on the slide. And I think if we can click one more time, thank you very much. So we mapped the available tools that the EU already provides for health systems along the process of change. So starting from ideas, when you need support in your health system, and figuring out how to solve a problem, like for example, workforce shortages, as Matthias was talking about, over to making concrete plans, pilots or tests, and how you go up to implementation. And we see that different tools fit in different phases, and they help with different types of, let's say, reform ideas and approaches. So if you haven't looked at our policy brief yet, it's on the Observatory website, and so my colleagues are going to put it in the chat. Take a look. It is a mapping exercise that basically identifies that we have quite a lot of support from the European Union. A lot of these tools are not primarily intended for health, which means that it's not always clear to member states that they can use them for health. And there's a lot of them, which always means that there is a bit of confusion about what can I use when. Does using one mean that means I cannot use the other one? So what would be a good idea would be to have more clarity about which tools are available for what, when, and how member states can use it. Keep that in mind. We'll come back to that on the next slide. So we click one more, thank you. When it comes now to the European Health Union, we see on the previous slide already quite a lot of action that the EU does, but based on its mandate, complementary to the main competence of the member states in healthcare delivery. When it comes to the pandemic, we realize we have a first proposal on the European Health Union from the Commission. It comes in November 2020 with main pillars of action that have to do with preparedness. So we have strengthening the health security framework. We have increasing the mandate of EMA and ECDC and the new executive agency to actually, to the authority to actually prepare for new pathogens. So this is the core of the European Health Union discussions that we are having around preparedness. However, what we see is that we have also a lot of new action when it comes to strengthening health systems that comes from the pandemic, but is not necessarily linked to preparedness per se, but it's rather linked to health systems resilience. So we have the Recovery and Resilience Facility, and we see that many member states opted to focus on health, among others, in their recovery and resilience plans. We have the cohesion policy funds, which we have used before the pandemic, but where new funds are earmarked for such initiatives towards strengthening health systems. And we have a bigger health program than we've ever had before with with EU for Health, as well as new calls for research, the new executive agency, HADEA, to manage all of that. And of course, also the idea that we use existing instruments, such as the technical support instrument, which is offered by DG Reform, to actually help member states in realizing all these steps. And final, for me, Giuseppe, it's current right now that member states are coming together to figure out how to create such a, for lack of a better word, one-stop shop for member states to understand how they can best use the tools already provided by the European Union. And I think this is already quite a step in the right direction for a stronger European Union.
That's perfect. I recommend, stay here with us, Dimi.
Yeah.
I recommend everyone to look at this resource that tells you really what kinds of tools and instruments you have available. Erica, what our participants think today about what are the key strategies they want to see in the European Health Union. Go for it.
Okay, Annalisa, if you could launch the results of the poll, that would be great. Okay, so people want more.
Oh,
very exciting and good news all around. And pretty much all of the in pretty much all areas. So only one person said none of the above. So it's a shame it's an anonymous poll because I'd love to speak to that person. But anyway, yes, in all areas, people want more collaboration. So very interesting for the discussion moving forwards. Thank you very much. Back to you, Joseph.
Indeed. Thanks very much indeed. I told you, Erica, we needed to give only 3 choices. Otherwise, everyone wants everything. But that's a real support for European Health Union. This is not the position of the Minister of Health of France, not of the presidency. This is the results of our poll today. Erica, now I'm going to ask you something difficult, which is summarize the contributions, the points, and the questions. I'll ask everyone to join, please, all the panelists and speakers today, and then I'll distribute the questions across. Please.
Okay.
Sweet and short.
We have
everyone,
almost
please open your screens and join us in this panel.
Okay, we have almost no time, so I'm going to. Lots of people want more. Are interested in more information on the hospital label. So I think we're going to have to do a webinar on that in due course because that's an area that people are very interested in. But apart from that, people are really interested in cross-border care and particularly how it relates to countries outside the EU. So the Eastern Partnership countries like Moldova, Ukraine, Georgia, also the sort of candidate countries. And should the EU be focusing on the big countries beyond the EU? So looking beyond to sort of like China and India. So quite big questions there. But a really important question that's come up is, how are we going to pay for all this? So people are really interested in how we can convince the ministries of finance to invest in resilience. So thank you very much.
Thank you. Wow, difficult ones. What I'm going to do now is, I think there have been 2 specific questions, one around cross-border, maybe to Matthias, and beyond our borders, a tiny bit reflection. And then there's the question of finance. I don't know whether Malika or Robert, tu veux dire quelque chose comme payer la facture de l'Union européenne?
I don't know whether Malika and Robert would like to answer that question. Malika, I know that you have been discussing with the presidencies of other countries as well. You've dealt with resources.
Perhaps to talk about some of the funds that are now available, because it's very much part of the work you did for the Slovenian presidency. So I will start with Matthias, followed with Dimi, And then I want a very short reflection, une réflexion très courte de nos collègues.
After that, we will talk with our colleagues from the DGOS.
I'm not sure if what was directed to me was, how do we pay for it? And when it comes to cross-border healthcare, it's actually not very expensive, you know, and it's not a mass movement of people. Of course, you have hotspots like border regions, like tourist places, some of the big cities where you have more cross-border healthcare, but it's not really very expensive. We have this sort of figure of maybe 1% of healthcare budget, but this is still a wild guess and nobody knows exactly because some countries don't report actually figures enough. So I think for the time being, cross-border healthcare is not a financial budgetary issue. The other thing beyond borders, I think that the EU has only competence to arrange things with countries they are part of the European Union or they have contracts with. Otherwise, we still have the possibility of bilateral agreement. And that should also be clear, you know, no country must abstain from having bilateral agreements with other countries, you know. So that's I think the option.
That's brilliant. Thank you. How do we pay the bill, Jimmy?
That's an excellent question. And just linking to Matthias, I agree on the cross-border care front, but talking to payers is, of course, there is a concern about how to pay from your budget with patients that are paid somewhere else, that are treated somewhere else. So this is the hospital label discussion we can have in the future. When it comes to it, I think we need to distinguish between funding at the EU level, where we have all these different instruments. Some of them are direct funding for infrastructure, others are funding for training, others are not direct funding, but are about supporting member states delineate policy. And then we also need to think about what the EU level policies means for funding at the national level from national funds. And I think what I can say very briefly is that in our policy brief and in our EuroHealth articles, in the EuroHealth issue, there's 2 of them, we reflect quite a little bit on that. It's not very simple, but it's not undoable. And I think we've already seen that investing in health, we had discussions for a long time before the pandemic, and I think the pandemic really nailed it for everyone, but this is not an expenditure, it's actually an investment, so we should look at it that way rather than the other way around.
Thank you very much. Alors maintenant, je vous demanderai à mes collègues français du
Thank you. Now I will ask my French colleagues to close with some last thoughts. Malika, I will now give you the floor. I know that you may have seen or heard of the reactions of our participants today. Many people have been asking questions about the European Health Union. Many people are happy with it. Do you think all of this is doable? What are your personal thoughts? You who represent the French Presidency, what are your personal thoughts? People want more of the European Health Union. What are your thoughts about this? Well, we as a member state, we will continue to fight to reinforce the European Health Union and health security, but also we will fight to strengthen public health, as I was explaining at the start. There was also the question out of very important and interesting. It is related to the report on the Conference on the Future of Europe. All European citizens were asked about this, and health was part of 20 recommendations and proposals suggested by the citizens. So we see that citizens are really engaged on this issue, on the issue of health. And the program really took off as well. And this is important from the perspective of investment. It's also important to diversify all of these areas, the digital area, in a cross-cutting way as well. So that's the path we've chosen, but it's not a question of creating a union for public health. It's a question of strengthening it. It's a question of really strengthening this. And this is also based on the tools that already exist, the pre-existing tools rather. Yes, thank you very much, Malika. Thank you. The speaker's internet connection is very poor. So yes, your internet connection is very poor, says Josep. Your internet connection is very poor. Yes, thank you, Malika. I apologize for that, but your connection is really very poor. However, the message is very clear. European citizens want more Europe, more of the European Health Union. And yes, as you were saying, the instruments and the tools are there. And we saw this during the pandemic. The tools already exist. And that will allow us to tackle this task together. So yes, people have been talking a lot about the hospital label. Can we talk a little bit about that? We don't have much time, but maybe we could talk about the hospital label. I know that you've been in discussion with member states. And I know that there will be more information about this very interesting idea later. So I know that there will be more information available about the European Hospitals Network. Would you like to add anything to your presentation in order to conclude? Yes, thank you. I just wanted to add we've been working with the Commission. The speaker is inaudible. The interpreter cannot hear the speaker. But yes, I would just like to thank the observatory for working with us on this. We are really very grateful for the work. And the support has been so needed and appreciated. Thank you. Thank you very much, Robert. Pascal, just very briefly, because our time is almost over. Could you maybe talk about this real participation? Do you think these experiences will make a difference? And do you think Europe can help put citizens at the center of innovation? Yes, absolutely, Josep. Now, there are two questions here. First of all, our healthcare systems have suffered a lot from the crisis, but they've also suffered because of these structural changes and these structural evolutions. So we need to be able to count on our citizens. We need to count on their engagement, because we know that they are interested in the future of health. The European Commission has been including citizens for years, but inclusion is really essential so that everyone can feel like they are actors, like they are part of this. Thank you very much. And Natalie, I have the same question for you, basically. Are you optimistic? Especially when it comes to continuing with this innovation, are you optimistic about that, about all of this when it comes to digitalization and new structures, new forms of organization? Are you optimistic? Yes, indeed. Throughout the crisis, this allowed us to start working. It also showed us how important these new forms of organization are, these new structures. And it allowed us to see how we can make them more permanent. So yes, I'm very optimistic.
It's very nice to finish with this note of optimism from all of us today, for more collaboration, more instruments. I would love to summarize and spend another 20 minutes telling you my ideas about it all, but that's not the idea. The idea is that we wanted to construct a webinar that exposed you to a number of strategies. We wanted to see the boots. We wanted to be the forest rather than individual trees and show you all the potential and possibilities and what we hope is a bright future towards constructing this European Health Union together without going into the politics, saying clearly the instruments, the will is there to work together and make more resilient health systems. Thank you very much for being with us today. Have a very beautiful day and join us again for the next webinar. See you. Bye-bye.